Why is quantifying happiness hard for consequentialist ethics? Imagine trying to weigh the happiness of one person against another, like comparing apples and oranges. It might sound simple, but in reality, measuring happiness is anything but straightforward. When we talk about consequentialist ethics, the goal is to make decisions that produce the best overall outcomes. But how do we know what counts as the best when happiness is so tricky to pin down? That's the core challenge. Happiness, or well-being, is deeply personal and influenced by many factors like culture, personality, and life experiences. What makes one person happy might not affect another the same way. So, creating a universal way to measure happiness becomes a real puzzle. Even if we could find a way to measure happiness within an individual, comparing these scores across many people is another hurdle. There's no standard unit or scale that everyone agrees on. Is a happiness score of 5 out of 10 the same for one person as it is for another? How do we combine these different scores to see what benefits the most people? Without clear rules, it's hard to say which action truly maximizes happiness for the greatest number. Predicting how actions will impact happiness in the future adds more complexity. In healthcare, for example, treatments can have unpredictable results. Doctors and policymakers try to estimate outcomes, but many variables can change the picture. Will a new medicine improve patients' lives? Will a policy reduce suffering? These questions are tough to answer with certainty. Another issue is fairness. Two situations might have the same total happiness, but if one involves a lot of inequality, is it really better? Should we prioritize helping the worst off or focus on overall happiness? These questions show how difficult it is to balance happiness with justice. Plus, healthcare decisions often involve other principles like respecting patient choices, fairness, and rights. Sometimes maximizing happiness might conflict with respecting a patient's autonomy or ensuring fairness. For example, a treatment that makes most people happier might harm a few individuals' rights. All these factors make quantifying happiness a real challenge for consequentialist ethics. It's not just about adding up happiness points. It's about understanding the complexity of human experience, predicting outcomes accurately, and balancing happiness with other important values. That's why many ethicists and healthcare professionals use a mix of measures and principles, rather than relying solely on happiness calculations. It's a more nuanced way to make fair and effective decisions in healthcare today.